Hey, future pharmacists, got exams on your mind? Well, you have come to the exact right place. Today, we are breaking down everything you need to know about ointments, from what they are to how they're made. So, let's jump right in.
But before we get into the nitty-gritty, let me ask you a quick question. When you think about any ointment out there, what's the one single component that dictates, well, pretty much everything about it? How it feels, how it works, all of it. What do you think?
If you were thinking the base, you hit the nail on the head. It is the absolute heart and soul of the formula. It's the vehicle that does all the heavy lifting. We're going to dive deep into bases in a bit, but first things first, let's lock in that official definition so we're all on the same page.
All right, so Section 1, the basics. This is the foundational stuff you've just got to know. It's the bedrock for everything else we're going to cover today.
Okay, here it is, straight from the textbook. An ointment is a semi-solid preparation for external application where the medication is dissolved, suspended, or emulsified in a suitable base. You hear that last part? In a suitable base? See? I told you it all comes back to that.
So before we start sorting them into different types, we gotta know what we're aiming for. What's the gold standard? Physically, you want it to be smooth, right? Nothing gritty, because that would just irritate the skin. Physiologically, it absolutely has to be non-irritating. And for the patient, it needs to spread easily and this is a big one, be easy to wash off. I mean, nobody wants to deal with a stubborn, greasy mess.
Speaking of properties, that brings us right to our next section, how we classify ointments. Now, for your exams, you need to know two main ways we do this. First, by how deep they go into the skin, and second, by what their actual therapeutic job is.
Okay, I love this slide because it breaks it down so clearly. Think about an ointment's mission. Is it epidermic, just working on the surface like a protective barrier? Or is it endodermic, meant to get into the deeper skin layers for a local effect? Or is it diadermic, designed to go all the way through the skin and into the bloodstream for a systemic effect?
The second way we classify them is way more straightforward. It's simply based on what the ointment does. You know, you've got your antibiotic ointments to fight off bacteria, anti-inflammatory ones to soothe reactions, and even parasiticides to treat things like lice. It's all about the action.
Okay, team, listen up. We are now at the most critical section of this entire explainer. Seriously, if you only remember one thing for your exams, make it this. Understanding ointment bases is absolutely non-negotiable.
And here's the good news, it's not as complex as it sounds. Every single ointment base out there fits neatly into one of 4 distinct categories, and these categories tell you pretty much everything you need to know about how they'll behave.
First up, we've got oleaginous or hydrocarbon bases. The classic example that everyone knows is petrolatum. Yep, Vaseline. These are basically oils. They don't mix with water, and they create this amazing barrier that traps moisture in the skin. The major downside? They are greasy and a real pain to wash off.
Next up, absorption bases. Now their superpower is that they are anhydrous, meaning they don't have any water in them, but they can absorb a ton of it, creating what we call a water-in-oil emulsion. Think of something like wool fat. They're still kind of greasy, sure, but they're a definite step up in the washability department.
Third, emulsion bases. You probably know these better as creams. And listen up, because this is a huge exam point. Water and oil emulsions are still greasy. But oil and water emulsions, those are the real crowd pleasers. And why is that? It's simple. They're water washable, making them way more pleasant for patients to use. We call that cosmetically elegant.
And that brings us to our fourth and final category, water-soluble bases. These are the greaseless wonders of the ointment world. We're talking zero oily components at all. The big player here is polyethylene glycols, also known as carbowaxes. As the name says, they just dissolve in water, which makes them super easy to put on and take off.
All right, let's pull it all together. This chart right here, this is your ultimate cheat sheet. It compares all 4 bases side by side on things like composition, how well they absorb water, and that all-important washability. This is pure gold for your exam, so honestly, hit pause and just let this one sink in.
So now that we know what goes into an ointment, how are they actually made? Well, when it comes to your exams, you really only need to worry about 2 primary methods.
Method number 1 is called trituration. This is basically just good old-fashioned mechanical mixing done at room temperature. You'd use this when you have a soft base and your drug is a solid that won't dissolve. The whole trick is to grind or triturate that drug into a superfine powder, then slowly mix it into the base. The big takeaway here? No heat.
involved.
And method number 2 is fusion. As you can probably guess, this one does involve heat. It's what you do when your base has solid ingredients with different melting points, like beeswax. Now, here is the golden rule of fusion, and it's a classic exam question. You always melt the ingredient with the highest melting point first. Then you add the others in decreasing order. This is so important because it keeps you from burning the ingredients that have lower melting points.
Okay, we have covered a ton of ground, so let's wrap it all up with a quick, rapid-fire review of the absolute must-know points for those university exams.
All right, pop quiz time. Let's see what you remember. Of the 4 bases we talked about, which one did we call the greaseless one that's completely water-soluble? I'll give you a second. If you said water-soluble bases, like polyethylene glycols, you nailed it. Great job.
And let's lock in the difference between those 2 prep methods. Titration, that's mechanical mixing, no heat, for soft bases. Fusion, that's when you bring in the heat to melt down solid ingredients, and you always do it in decreasing order of melting points. You gotta know the difference.
And here it is, your final exam checklist. I like to call this the 4-3-2 rule. It's your key to success. You absolutely need to know the 4 classes of ointment bases, the 3 types of skin penetration, and the 2 main methods of preparation. If you can master the 4-3-2 rule, you are going to be in fantastic shape for your exam. So I'll just leave you with this last thought. Never ever underestimate the power of the base. It's not just some filler. It's the vehicle that defines everything. The ointment's function, its feel, and in the end, its effectiveness. Master the bases, and you've mastered ointments. Good luck with your studies.